Bringing a new life into the world is a momentous occasion, filled with anticipation and excitement. Expectant parents face important decisions, one of the most significant being the choice of childbirth method. Traditionally, childbirth occurred naturally through the birth canal, but advancements in medicine have provided an alternative: cesarean section, commonly known as a C-section. Both methods have unique aspects, and understanding each one is crucial for making an informed decision. C-sections are surgical procedures where an incision is made in the abdomen and uterus to deliver the baby. The choice between a C-section and normal delivery is deeply personal and should be made in consultation with a healthcare provider. Factors influencing this decision may include the mother's overall health, the baby's position and size, and any potential complications. A cesarean section, often referred to as a C-section, is a surgical procedure performed to deliver a baby through incisions made in the abdomen and uterus. This method is typically employed when a vaginal delivery is deemed unsafe or not feasible. During a C-section, the mother receives anesthesia, ensuring a pain-free experience. The baby is then carefully extracted through these incisions, and the umbilical cord is clamped and cut. Although a C-section is generally considered safe, like any surgery, it carries inherent risks and potential complications. Normal delivery, also known as vaginal birth, is the natural physiological process of childbirth, where the baby is born through the mother's birth canal. This process unfolds in stages, each marked by distinct sensations and physiological changes. The first stage, labor, involves the gradual opening of the cervix, characterized by increasingly intense contractions. As labor progresses, the baby moves down the birth canal, guided by the mother's contractions. The second stage of labor, delivery, begins when the cervix is fully dilated and the baby's head starts to crown. With each contraction, the mother pushes, aiding the baby's descent through the birth canal. Finally, the baby emerges, taking its first breaths of air, and the umbilical cord is clamped and cut. Normal delivery is generally considered safe for both mother and baby, but as with any medical procedure, there are potential risks and complications. Section 4. Weighing the pros and cons, C-section. Cesarean sections offer a predictable birth experience, allowing for scheduled deliveries and reducing the uncertainty associated with labor. C-sections can be life-saving in emergency situations, such as fetal distress or complications during labor. However, C-sections carry inherent risks, including infection at the incision site, bleeding, and adverse reactions to anesthesia. The recovery period following a C-section is typically longer and more challenging than that of a vaginal birth. These risks highlight the importance of careful consideration and discussion with healthcare providers. Section 5. Weighing the pros and cons, normal delivery. One of the most significant advantages of normal delivery is the quicker recovery time compared to a C-section. Vaginal birth promotes the release of hormones that facilitate bonding between mother and baby and encourage breastfeeding. Normal delivery reduces the risk of certain complications associated with surgery, such as infection and bleeding. However, labor can be unpredictable and lengthy, sometimes lasting for many hours or even days. In some cases, complications during labor might necessitate an unplanned C-section. Section 6. Making the best choice, a personal decision. Choosing between a C-section and normal delivery is a deeply personal decision influenced by a multitude of factors. Open and honest communication with healthcare providers is paramount throughout the pregnancy journey. Understanding the risks and benefits associated with both C-sections and normal deliveries is crucial. Ultimately, the best choice is one made collaboratively between the expectant parents and their healthcare providers. Respecting individual preferences and values is paramount, fostering a sense of agency and control throughout the childbirth experience.